Hi, Dr. Winter.
How are you?
Good, how are you? Can you hear me? We're going to go ahead and get started. Just as a reminder to all the members, don't forget to chat in and sign in with your name. And then I'm going to just go ahead and let Dr. Winter start talking. He is a DVN that specializes in dentistry. I've actually seen him work at the Sedgwick County Zoo before. And so I'm going to go ahead and actually just let him start talking. Thank you for being here, Dr. Winter. I don't think we can hear you, Dr. Winter. Um, nope, we still can't hear you.
How about now?
No, we can now.
I'm trying to share my screen and
Oh,
it won't work.
let me do that for you. Try now.
Thanks. All right, let's see. Can you see it now?
No, we can't see anything yet.
There?
Mm-mm. Yep, there it goes.
How's that?
Yep, it's perfect.
Sorry about that.
It's okay. I'm gonna mute now, so I'll let you go ahead and do your presentation, okay?
Thank you.
Mm-hmm.
Hi, everybody. My name is Doug Winter. I'm a diplomate of the American Veterinary Dental College and a founding member of the AVDC Zoo and Wildlife Dentistry Group. I provide dentistry and oral surgery services to Kansas State University Veterinary Health Center and to other referral hospitals in Kansas and in Arkansas. We work with about 10 different zoos. I'm usually somewhere once a week. Tomorrow I leave to work at a zoo. So we usually try to do at least 1 to 2 cases a week. I appreciate you all joining me. I was a general practitioner for about 20 years and then got the itch to do a residency. And then left general practice to do this in the last, I think, 10 years. So it's been a lot of fun. So we're going to talk about some cases. I've kind of developed a niche within my profession with exotic dentistry and would like to share some cases with you tonight. Kind of how we work with them and some of the things that we get to do. So the pictures that you're going to see on screen are mine. I mean, I didn't necessarily take them, but they definitely are all cases I've worked on. As you probably can understand with the zoo and wildlife cases, a conscious oral exam rarely exists. So pretty much everything we do has to be under anesthesia. And many of these cases don't get under anesthesia, except maybe every 2 to 3 years. Partly because they're dangerous, partly because there's fear of the anesthesia. The other part is that a veterinarian at a zoo can't always get through all the cases as quickly as they would like to. So wellness exams don't happen every year. Most animals are not diagnosed until clinical signs are treated or noted, which makes it difficult then because the pathology has been quite chronic. And There's also an extreme amount of lack of exotic dental knowledge. We don't have a lot of published papers. Experience is minimal. Equipment is very, most of the stuff I have, we've had made. And so all of this contributes to oral pathology not being dealt with in a very timely manner. The other part is that some of these cases like the giraffe or the marsupials, some of the hoof stock, it's hard to have oral access. Tomorrow, we're going to do a couple poodoos. If you don't know what those are the smallest exotic deer. And so their mouths, besides being super small, you can't get good access by the way their face is shaped. Secondly, zookeepers. So zoos kind of work like a general practitioner does. The zookeeper is kind of like the pet owner. And if they happen to notice a concern, they let the zoo veterinarian know about it. So a lot of our zookeepers, understandably, are untrained in this. They're unable to recognize dental problems, let alone the animal hides it a lot of times. So a lot of pathology becomes advanced very quickly. And then consequently, when we treat, sometimes things are kind of guarded for success because they are so chronic. So dental problems are multiple, they're complex, they're unseen. Sadly, they're not always timely. And as we know, if you've ever had a painful tooth, I've had one in my life, it can be very debilitating. So these animals are unique. Many of them are endangered. And so oral pathology can affect them greatly. So take it a step farther. In 2015, we did a study with 149 animals who were anesthetized for just routine exams. And what I did was a complete oral exam and dental radiographs on every one of these patients. And what we had found is that greater than 95% of these patients had needed some level of treatment within their mouth or needed future monitoring. So it's extensive. And in fact, it actually exceeds what we find in the domestic animal. Many times we consider 80 to 85% of our dogs and cats need some level of oral care. The zoo patient can exceed 95%. So this is a text I got probably 6 weeks ago from the Memphis Zoo. And this is a giant panda. And so this is very common that I get these texts with pictures and asking me what I think and, when can they schedule? How quickly can I get there? And so this giant panda has an obvious fracture on both sides of its first molar. But the issue is I also notice other things. If you see the green arrows, both of these canines are fractured also. So the zoo veterinarian, with very understandably, is focusing on the fractured molars, which obviously look very painful, but I see also that the canines need to be dealt with. So like I said, most of these animals have multifactorial things going on. So a lot of times the zoo has a plan, even I have a plan, and sadly, when we get to reality, it takes quite a few steps to get it to happen. The other part about zoo work is that you have to be prepared for the unexpected. Always do I have contingency plans in place. What to do when things go wrong. Many times we can't prevent things from going wrong. And so we have to have a strategy to deal with bumps in the road and do them as efficiently and painlessly as possible. So a lot of times we're thinking quickly because we only want to put the patient under once. And that doesn't always happen that we can do that, but we're always planning for the what ifs. Sadly, I'm most of the time a fireman. They call me in when they see a fire. When they've got a problem, they call me and I'm supposed to fix it. my goal would be to be Smokey the Bear. And that's where I would love to come in and do more preventive measures, because these patients are not then going to suffer near as much, and they're going to have their dentition longer. So how do we work? We pretty much on day cases, we take literally everything. So I'll load my Suburban up just like I did today, and I pack literally every piece of equipment that I have, because I have no idea what I will need. When we make longer trips that are either multiple zoos or overnight, we'll pack up a trailer to go with us. And you know, as I was speaking with a group out of Arkansas this last week, that is part of the benefit of what I bring. Is I bring everything. They don't have to worry about any dental instruments, any dental equipment. They don't have to worry about any of it. They just need to provide anesthesia. Because most of the zoos don't have this equipment. They don't have the proper instruments. As long as they tell me the species we're going to work on, we pretty much have everything. And literally, we can do something as simple as an extraction or a root canal. We can do a mandibulectomy if we had to. And literally, we have gone to those extremes sometimes when in a trauma case, we think it's one thing, and lo and behold, we have to fix a fracture. So the other big question is the animal going to come to the OR? And so here's some examples. This happens to be the OR at Sedgwick County Zoo, which we do a lot of work at. Most of the zoos I work at, their facilities are incredible. It is extremely fortunate to be able to be in these surroundings. A lot of these zoos have incredible ORs and places that we can work. And that makes it so much easier and so much more fun. Here's a white tiger that we have done. Again, very, very nice facilities. And then sometimes we get lots of audiences. This happens to be a zoo at the Oklahoma City. Here, literally, their whole hospital is open to the public. And so when we're doing surgery, we've got all kinds of people watching us. And we did multiple surgeries on a hippo, and you know, they had to go and explain why I was on top of the table with a mallet and osteotome hammering this tusk out of this hippo. And so they had a lot of explaining to do. So you've got all extremes, and you work with what you get. But this is a beautiful facility, but the public literally gets to see and watch everything. Then sometimes we have to take the OR to the patient, mainly because they're big or because of certain circumstances, they can't be transported. So in this case, we're in a bear den and most of it's underground. So we literally have to bring all our own lighting, all the equipment. There have been times where we've had to have a generator. And so in this case, you know, we're working on this grizzly bear and we're inside this little den, and it's extremely cramped quarters. So here I'm doing a root canal. You can see the anesthesia machine is literally outside of this little den. I don't know if I'll back up here, but through this opening right here is the rest of my equipment. So I take a radiograph and I have to go back through there. And so none of this is easy, but you got to work with what you have. Here we're in a lion's den. Doing the procedure where we're in these cramped quarters. This is a little gorilla pad. So along each of these walls are there what they call their bedrooms. I believe there was 4 on each side. And so here we're working on a gorilla in the middle of this hallway. Again, cramped quarters. You know, I get asked a lot, well, what, you know, yes, we always know our way out of there in case something happens, but you have to make do with what facilities you have. Sometimes you have to block off part of the zoo. So here they closed part of the exhibit because we needed to work on this camel. And so they just closed it off and allowed us to put this animal under anesthesia so that we could work. And this is also at Sedgwick County. So here's one of the elephants, which we're going to talk about later today or tonight. But we had to use the exhibit to knock this patient out, and then we just worked on it in the middle of the arena. And then sometimes these animals are being transported. So this is a cat that was transported from another state. And when they got it, they looked in and saw a tooth on the floor of the crate. And so the cat had fractured it on the way. A little bit about dentistry, when a fracture happens and when it happens, I have 48 hours to have the ability to keep the tooth alive. So in this case, this patient got there, I think, on an afternoon, and we literally had to scramble so that we could do surgery on it the next day, so that we could save that canine tooth and keep it alive. And so we did surgery in the crate. That's on the left there, that's me inside that crate working on the animal, and the anesthetic machine is on the outside of the crate. So let's talk about some of the specifics. These on primates, there's all sizes, all kinds. We've worked on all of these guys. So basically, these are the types of primates. You have the great apes, the monkeys, the lesser apes, and the prosimians. The way I kind of keep track of them is based on their number of premolars. So the prosimians and the New World monkeys all have 3 premolars. And then the Old World lesser apes, greater apes, and of course us, we have 2 premolars. And so even though their dentition is remarkably the same, we have tremendous size differences. So for example, on the left is a gorilla, on the right is a squirrel monkey. So even though their dentition is much the same, and actually the squirrel monkey on the right has an extra 4 teeth versus the gorilla, the size difference requires a lot of different changes, different instrumentation, and frankly, everything's different just to be able to get inside their mouths. So here's 2 differences. You can see the dental explorer and the size of this patient. So the gorilla can easily exceed, 400 pounds, and that squirrel monkey is, going to be less than a pound. So here's a first molar on the left from a gorilla, and on the right is a first molar from a squirrel monkey. So like I said, instrumentation, most zoos don't have any of this to get these teeth out if we need to, or to work on them. And that's the benefit we have of being able to show up at their place, is we have all of this stuff. You have to know your anatomy. So here's a lemur, and they have a comb on their mandible to keep their coats the way they do. And so they have 4 incisors, and actually the 2 on the outside are their canine teeth. And most everybody thinks that these are the canine teeth, but actually these are the second premolars. So, when I tell people I've done, a root canal on a premolar, that's very unusual, but yet they're like, these premolars are like canine teeth. So you have to know anatomy. And all of these guys are a little bit different. The biggest thing with primates is zoonotic diseases. They're extremely serious. They definitely can give you things that you can never get rid of. Hepatitis, tuberculosis, herpes. And so it's extremely important that you're properly gloved up and masked. So this is not a COVID picture. This is actually, what we do for every time we see primates is we double glove, have masks and eye protection just for the sheer issue of the diseases they can transmit. The other part of this picture is especially on the chimpanzees and the gorillas, there's usually a team approach. we have multiple disciplines there to work. So for example, down here in the lower left is a human cardiologist that comes. So the great apes have heart problems. And so there is a database that keeps track of all these gorillas and monitoring their cardiomyopathies. And so almost always there's somebody doing an echo when we work on a primate. On the right, this is at Houston Zoo. Female gorillas, they're going to have a pelvic exam by an OBGYN. So like I said, we have multiple disciplines making good use of an anesthesia to make sure these animals are all healthy. And so we all take our turns, and many times we're all working at the same time. They're big, they're dangerous. So everybody has utmost respect of what we're doing. Most of the zoos that we work with, especially with the gorillas, everybody, I can't tell you how serious everybody is, and everybody's got a job to do. Everybody watches for everybody else. And if these guys wake up, we know how to get out. We know what to do. We know who stays. And so, but they're incredible animals. And then you've got a squirrel monkey. Again, I'm playing the extremes, and they're obviously super small. So the big thing about gorillas is they have a very short airway, just like you and I do. And so being very, very careful about all the fluid we use inside the mouth is very, very important. So, when you're sitting in the dentist chair, it's very easy for you to spit into the suction device or a cup. We have to use a lot of suction, and we pack the back of the mouth when we work on these animals because their airway is so short, and we do not want to get anything down there. So a little bit about some of the more common pathology. Enamel dysplasia or hypoplasia is very common. Primates do not have very thick enamel. Actually, it's thinner than yours and mine. And so a lot of people think this is plaque and tartar, but it's not. It's abnormal enamel, and we monitor it very closely because caries or cavities can develop quite quickly. So all of this is normal, and you have to be super careful when you're scaling and polishing against this because you can go right through it. So there's something specific in primates called linear enamel hypoplasia. So LEHs occur most often in orangutans, up to almost 85% of them. We see it in chimpanzees and gorillas too, but not near as much. So I don't know if you can appreciate these lines. So these are much like rings in a tree. And what this means is that these defects form due to some kind of physiological stress. And a lot of studies have been going on because these happen in the wild, and it happens in zoos where something disrupts the enamel that's laid down, and it causes these enamel rings. It really doesn't cause any pathology to the patient per se, but it is something you monitor, and you make sure that it's just something extremely unique. And like I said, they've been studying it and trying to figure it out. Here's some other cases. You can see here these lines. These are called linear enamel hypoplasia. The other thing we see is draining tracts. So here's a tamarin with a fistula underneath its chin. Here's a chimpanzee we did down in Houston, also having a draining tract. And almost always these are a result of fractured teeth. So what's sticking out of this fistulous tract is something called gutta-perca. And this is what I use. Well, they use it in human dentistry too, for root canals, but I use it for figuring out where a fistulous tract comes from. So here we have two fractured teeth. I wasn't sure which one was causing the draining tract, and this fistulogram allowed me to know which tooth it was. So kind of unique. But this is what ends up happening. So this is a large canine tooth on a chimpanzee, a canine that has pulp exposure. And so they get into lots of fights, And so trauma is the main reason for their fractured teeth. Here's a gorilla with a fractured incisor. So the size of these teeth, their roots are almost 2 centimeters long. And so what looks like not a very big tooth ends up being super long. And so getting even an incisor is quite a feat. Probably the most common thing we see is periodontal disease. Most of you are trying to get into vet school, and I wish you the very, very best. But literally, when you graduate from vet school, the most common disease you will diagnose in your whole career is going to be periodontal disease. And so all of our animals have it. And so just like people, these primates have it also. And it's probably they have lots of high risk factors for it. A lot of it's genetic. Their gene pool is very small. And so some of this ends up being genetic also. So here is a 23-year-old gorilla that diagnosed periodontal disease. You can see the bone loss between the first molar and the fourth premolar. Very, very common spot. And as I shared with you earlier, the sad part about this is that we do not always get to see these patients for another 3 years. And so we did a lot of extensive surgery on trying to save that tooth, that pathology on the left side. And then when we looked back 3 years later, you can see how it progressed. So I've done a lot of talks on periodontal disease in primates, and it's an extremely frustrating disease, but it's literally a losing battle when you cannot see these patients every year. And bluntly, if you and I had periodontal disease, we would be at the periodontist probably every 6 to 8 months, and sometimes more frequent as they do their initial surgeries. But you cannot manage periodontal disease seeing them every 3 years. It's a lost cause. And so we end up extracting a lot of teeth. So to make that relevant, here's Keyview. I first met her quite a few years ago. At that time, she was 34 years old, and she actually came to a bachelor pad in the male gorillas, and they were going to start a breeding program. And so she bluntly was still in quarantine when they called me and had noticed 3 days of not feeling well and being very lethargic and not eating. So under anesthesia, we had this massive swelling to the left side of the face. And I realize pictures don't do justice, but it was huge. And obviously everybody was concerned about an abscessed tooth. So as I take this picture closer, I don't know if you can appreciate this dark area, but this area was very soft and was probably going to be rupturing very soon. But bluntly, this was the tooth root abscess. And so looking in the mouth, I see all this pathology, and I look at the dental record because most all of these gorillas before they're shipped get an oral exam, and very few notes of any pathology was made. And so if you see on this bottom picture, these are draining tracts. So this animal has a lot of periodontal disease. You can see here we have bleeding already. And when we look in the cheek where this swelling was, this gorilla was chewing on its cheek because of the massive amount of swelling. And so again, just lots and lots of inflammation. So this dental radiograph shows right here an abscess of the fourth premolar. And so we ended up extracting that tooth. We opened this abscess up and drained it and appropriately treated it. And, Keyview did a fantastic job. She healed up well, started feeling better, eating and acting her old self. So this was, when I first met her, was June of 2013. November of 2013, they allowed me to go in and fix the rest of her mouth and deal with the rest of the infection. As I shared with you, then it was March of 2015 And by the way, November of 2013, that second procedure, we did a lot more extractions. So in March of 2015 is when I got to see her next and had another 4 extractions. So I asked if Keyview could be my little study. And what I asked them to do was to let me look at her mouth every year. And so I have been doing that every year since 2015. And we did her at the end of last year. And we've had literally no extractions since 2015, just because we've been able to take care of her mouth literally every year. And so I know you don't know this, but we call this bleeding index. So when your mouth or mine, or when we probe an animal, when we probe and it starts bleeding, it's a primary indication of periodontal disease. And this is my probing. I've already probed this animal and there was absolutely no bleeding. So I realized my little study of 1 proved my point, is that if we could get in these animals' mouths quicker and more often, we'd be able to save teeth, they would feel better, and they would do better. So Keyview is my little study, and she's had 2 babies since, and she's a great mom, but she's a good gal. So prevention is another part of this. The 2 places I work with the most is down in Houston and obviously Sedgwick County Zoo. So these guys get brushed every day. And so this is Keyview. And if you watch here, everything's about reward. And so they brush their teeth. It helps. There's just no question it helps, just like when you and I do it. And so they get a treat and we brush their teeth. So there we go. Yeah. All right. Let's talk a little bit about some of the exotic felids. So they have the exact same dentition as cats. So on the right is a domestic cat skull, in the middle is a bobcat. And just to give you a reference, on the left is a tiger. Probably the biggest issue is abrasion and attrition. Abrasion is when they wear part of their teeth. So you can see here, they've worn a lot of their tooth structure off, is due to gnawing on things such as cages, bars, toys, and then attrition can happen due to malocclusion. So here's a tiger, and I don't know if you can appreciate, but you see this area right here, this is open. This is a complicated pulp exposure. And if you follow this down, this pulp canal is almost completely exposed because this tiger gnaws on a bar. And so a lot of these tigers have some anxiety issues, and they do this. So here's another case where they actually will grab the wire and they will wear the back of their canines off when they rock on the wire or the cages. And then what ends up happening, so if I draw a line right here, this is how much of the tooth structure is gone. And then what ends up happening is when they barely have to push on it or pull, they'll snap them off. And then we have pulp exposure and a tooth that has to be either surgically extracted or have endodontic therapy. Here's another one. And actually, here's one that literally broke off at the gum line. So, everybody thinks we need to extract these teeth, but we end up doing what's called a type 2 crown lengthening, where we literally lower the gingival attachment. So this is that tooth. If you see here, we then did a root canal and we lowered this and we allowed more crown to be exposed. Here's more fractures. We see this a lot. In fact, I've got 2 of them in a couple weeks to do. And we did 2 of them just probably 3 weeks ago, where we did root canals. So here's another. So anytime there's pulp exposure, whether it's these guys, a dog, a cat, you or I, you have 2 choices: either surgically extract them, or we do a root canal so that we can keep the tooth and keep it functional. And part of the main reason we keep these teeth in these big cats is because they're huge. They're a good 2 inches to 3 inches long underneath the bone, and it takes a lot to get them out. And then a lot of times if they're damaged, we do prosthetic crowns on them so that we can further protect them. So we do a fair number of these. And then another thing that I see a lot in tigers is where they will fracture their palatal cusp of their upper fourth premolar. And I realize you may not know about their dentition, but this root right here is on the inside of their palate. And these big cats fracture these a lot. And so we've done a lot of lectures on these to zoos to monitor these, and we see this a lot. Here's another one where they literally fracture this off, and we end up having to either extract those teeth or do root canal. In domestic cats, we see lots of tooth resorption. In fact, up to 60% of all domestic cats will have at least one tooth with tooth resorption. The only species that I see it in are leopards. And here's a case that all three of these teeth have tooth resorption. It's very painful. And the sad part about it is, here it is right here. You can see it on radiograph. They're called type 1, but the sad part about it is they're very painful, and we end up having to extract these teeth. So there are huge surgeries when we have to because their teeth are so big, but you cannot save these teeth, and they are very painful. Here's another case. You can see the lesions right here. Periodontal disease does not happen often. Usually it's due to trauma, so they'll bite down on something and cause a tear in the gingival attachment, and then periodontal disease will set in. So versus primates and our domestic animals, we don't see a lot of periodontal disease in big cats. Eosinophilic granulomas. This is a plaque, a granuloma that develops on the roof of their mouths. There are dogs and cats that get this also, but this specifically seems to occur only in white tigers. Out of all the white tigers I've seen, I've never seen one without one. And they're big, and they can be very ulcerative. They can be painful sometimes. They're usually, we think they're attributed to some type of an allergy, but they're very, very difficult to get rid of. And sometimes they literally ulcerate, and that's the hard palate. And that's when they become super painful. Let's talk about bears. So these guys we've all worked on. This is a sun bear we just did not long ago. So just for the fun of it, I left the cat in there. Probably dumb, but I did. This is a black bear, and this is a grizzly. So the biggest thing about grizzlies is that they have malocclusions, specifically class 2. And so when that happens, they have a lot of tooth wear. So they'll wear their teeth in these areas because their occlusion is not normal. And it's genetic, but we see a fair amount of it. Some bears have class 3. This is where their mandible is longer than it should be. Obviously, this bear has a lot of other problems, but this is an example that I saw of a class 3 malocclusion. And then the other part is abrasion and attrition. So abrasion, all of these are types of wear on teeth. It's just what causes it. So abrasion is caused by an object. All right, so a cage, something causes abrasion that the animal is chewing on. Attrition, it happens when teeth cause it, like in a malocclusion. So to remember that, attrition has T's in it, and that's a tooth does it, so that's how I remember it. So abrasion occurs a lot in bears, and partly because they're omnivores. Most of the time, they're on a vegetation diet. And so we see lots of wear. And then what they do is they wear their teeth so much that they cause pulp exposure. So these crowns are all severely worn over time, and they have all these big abscesses. And so we did a sun bear 10 days ago, we did. And it was almost a 3-hour surgery, and we extracted 7 teeth. These teeth are huge, and they're extremely difficult to get out, but you have no choice but to extract them. And then what ends up happening is that if they're left alone, they will then abscess out the jaw. So that's what this shows right here. So again, this pathology just festers when we don't know it's there. Here's another case. Actually, the abrasion caused this tooth to fracture off, and you can see the lesions here, and these had to be extracted. They also break their canines. It's very common. We do lots of root canals on these. So here's a case right here where we did a root canal on this tooth. Oops, sorry. This one was so chronic, we actually had a draining tract. So again, I talked to you about that gutta perca, and sure enough, when I followed the tract, it led right to the apex of this big canine tooth. And so this tooth had to be extracted. They do get periodontal disease for the same reason everybody else does, due to plaque and extractions. So let's talk about a few other cases and we'll finish up. This is Kiowa, pronghorn, very old. They don't live much past 15, but this guy presented for severe weight loss. Had a body condition score of 2 out of 9, so practically emaciated. And bluntly, I don't think he was recognized in the group, but when they did, obviously it was very, I mean, he was just losing tons of weight. And the reason I was called is that there was a draining tract or a sore on his right mandible. So when they put him under anesthesia, let me back up. So hoof stock have 3 premolars and 3 molars. And then they have 6 incisors and what we call a mucosal pad on their maxilla for, for taking off grass. And so, so again, these are what we call hypsodont teeth. They keep growing as they wear. And so different dentition, and you've got to know all this. And so getting to these teeth is not easy. So here's this draining tract. And as soon as the animal was under, I felt it and I knew we had a big time problem. And what ends up going is we have a pathologic fracture. And so one of 2 things is going on. One is that periodontal disease was so aggressive that we formed an osteitis or an osteomyelitis and the jaw fractured. The other was that we had a tumor that ended up becoming this aggressive and the jaw actually fractured. So in talking about treatment options, we didn't have many. And so what I threw out there was that we remove the mandible, get our pathology and see how the animal did. And so it was a huge debate of whether to just euthanize or to try the surgery I recommended. And so they elected trying it. So what we did was, these are the teeth on this skull. So here's the 3rd molar, the 2nd, the 1st, and then these are all premolars. And basically what we're going to do is remove this whole jaw and send it in for pathology. If it's osteomyelitis, we likely have cured the animal. If it's a tumor, unlikely. Okay. So we remove the jaw and to get to the jaw, I had to do what's called a commissurotomy, where I literally opened this up so that I could expose that whole jaw. So if you'll remember clear in the beginning of this talk, I told you when we had the giraffe up there that some of these guys were very difficult to get to their dentition. And even tomorrow, there's a very good chance I'm going to have to do this on these poodoo because I can't get to their teeth if I have to. And so we open this all up so that we can expose this. And I did this so that I could remove the jaw back here and remove it up here and then take that all out and then reconstruct all of this soft tissue. And so the picture here below is me closing this incision. So Kiowa's surgery sites healed greatly, had no complications. Literally, well, sadly, it came back as squamous cell carcinoma. So there was not a good prognosis. They put the animal on piroxicam, which is noted to help decrease the recurrence of squamous cell carcinoma. He gained all his weight back. Everybody was ecstatic with his recovery and how well he did. He acted like a totally different animal. But the biggest question I get is well, how do these guys eat? So he does have a drift because he has no mandible on his right side. He obviously looks weird, but he's able to eat his grain, and he did super, super well. So we've done quite a few of these surgeries. We call them salvage procedures. So we go to quite extensive to help these animals be more comfortable. But there's obviously what we call morbidity. Morbidity means that we change the animal, but he did super well. He lived for I think he lived for 13 more months. And then he had to be euthanized because the tumor came back. So that's Kiowa. This is Alice. This is an aardvark. She's an aardvark. So she's 14 years old. Aardvarks are extremely unique. They're the only representative of the Tubulidentata group. And the reason is, I'm sorry, she had a swelling of her mandible. And so these guys have a super unique dentition. They have no enamel, and their teeth are made up of tubules, dental tubules. And so their teeth wear a lot or very quickly, but they have no enamel, and they're way, way back in their mouths. Again, very, very difficult to get to. So this is Dr. Hodgson, anesthesiologist who helps me a lot. And so they're intubating this animal, which is extremely difficult. They have a 27 centimeter tongue that is in the way. And so trying to intubate them all the way down their nose, through their mouth is quite a feat. And so this is a video scope that was used to help get them intubated. So these are the radiographs. And so we have lots of periodontal disease and fractured teeth, tooth resorption. So we had a lot of teeth that we needed to extract. And here's the opposite side. Again, this tooth here had to be extracted, this one, and both of these. So what you do here is we had to make a window. And so here are the teeth that I had to extract. And so with instruments that I had made, they're all angled. We then extracted these teeth in these windows, and we can only do one side at a time, just because you can't have two holes in their maxilla, in their cheek at the same time. And so here's the teeth I'm extracting, and we got all of them out, and we sutured it, and we did good. So, all right, I want to talk about Rex. So sometimes we're called in to do repair on beaks. We call it beakistry, but Rex is a really a case I'm really proud of. I was out of state working at another place. I don't remember where, but I got texted by the zoo that said they had a stork that broke its beak and hadn't eaten for at least a week. They'd been tube feeding it, giving it fluids, but wanted to know bluntly if I would be home in the next 48 hours because they didn't think the animal would live, or the bird would live, or they were going to have to euthanize. And I said, absolutely, I'll be back. And so this is the trauma. And basically, there's lots of nerve endings. And so these are extremely painful, and there's no way for them to pick up their fish and eat. And so this guy literally was starving to death because of how discomforting this was, and let alone non-functional. Okay. So under anesthesia, what we did is we knew how far we had to go back to get normal beak. And so we made our cuts, and then we used these pins that are in here are used in human dentistry for posts. And what posts do is they help for core to make prosthetic crowns. So if you fracture a lot of your most of your tooth off, they will put these, after they do a root canal, they will put these in your canals. They will thread these into your canals, and they will do core buildup so that they can put a crown on your tooth. I use them to thread into these beaks. And so you can see how many I put in there. And then I use this wire, which is another type of post, and it's threaded to make this. And this is actually going to be kind of like my rebar. And so we use a self-curing prosthetic composite that's used for crowns. And I put this all over there and let it set up. And then I shape this. And I shape this. So definitely the beak is shorter, but now we have a functional beak. Okay. And then these pins help it hold it on. And let me pause here a little bit. I get called I get called fair amounts to make prosthetic beaks. And most everybody thinks these will last forever, and they do not. These only last for a short period of time because the beak will still grow, they become damaged. And all we're doing is trying to provide a functional method for these animals to maintain nutrition until these beaks heal. And so there's no way this will stay on forever. So we made this beak. I painted it so he wouldn't be made fun of. And then this is what the cool part is. And this is going to take a little while, but this bird hadn't eaten in almost 10 days. And so literally within a few hours of him waking up, he was going after his fish and he was eating, which he hadn't done in days before. So it was just a really, really cool case. Come on, Rex. There we go. He took it down. So the other cool part is, I don't know if you know much about zoos, but they do tend to do a lot of testing. And so there are database banks and all kinds of things they do because so many of these animals are endangered. They do as many studies as they can. And so Rex's blood got sent off. And I found out when I took his beak off, so his paint wore off, but I took his beak off and he was doing great. But when I took his beak off, they told me that Rex was like a genetic stud. His genes were out the wazoo. And so he got transferred from the zoo to some other place so that he could share his genes. So, here was a bird that was about ready to die and be euthanized within 2 days and ended up being some genetic stud that, I thought it was a cool case. So it was a lot of fun. So anyway, that's Rex. All right, I'm about done. I'm going to share 2 more cases with you of extremes. So this first case is a young, these are 2 elephant cases. And it just goes to show the planning that we have to do sometimes. So this is a 7-year-old elephant who is young. He's not happy. He broke his tusk. And so I don't know if you heard me say before with the tiger that came and broke his tooth, we have 48 hours to fix this before we're concerned that we can't save this tusk. So he broke off what looks like to be almost 11 inches of his tusk off in an oblique manner. You can see the blood, so the pulp is exposed. So when I got texted about this happening, I was out of town like always, but I was out of town and I told them, we've got to do this in 48 hours. You guys have to get your anesthesia stuff ready. I'll be there. And so literally, you don't expect this to happen, but when it does, you have to get ready super, super fast. And so quite a few years ago, they made the rule that you cannot work on these elephants without being in one of these chutes. And so wherever they have groups of elephants, we have to have these large chutes. So I don't know if you've ever seen the large animal chute at Kansas State for the livestock. Take this chute and double it or 3 times the size of it. The thing is that this young elephant had not been trained yet to go into this chute. So we had no choice. We couldn't use it. And so we met as a team the day of, and we knew what we needed to do. Everybody had a job to do, and I can't tell you the amount of stress. And so they darted this elephant in this large exercise area, and it's called M99. It's the most powerful narcotic known to man. And within probably 12 minutes, he was on his side. And so we then went in and, obviously they tied him up appropriately. Everybody was doing their job. We have 3 veterinarians here monitoring, and of course, me doing my work. So the first step we did was take a radiograph to see where this pulp was. And so you can see here the pulp canal. As you know, radiographs are 2-dimensional. So now we had to take it from the other side, and you can see our oblique fracture. And this is the part that kind of stressed me out, is we literally had to take this tusk back farther to have normal dentin for me to build a composite to and hopefully keep this pulp alive. So we knew where we had to make our cut, and we did that. So I have 2 elephant kits. Yes, they're all DeWalt power tools, but they're all dedicated to these large animals we get to work on. But that's what you have to use many times to get their teeth worked on, is these power tools. And so then I figured out what I needed to do to restore above this pulp and keep it alive. The difficulty is that the pulp, or the nerve of a tooth, is mostly vessel and nerves. And in a dog or a cat, they bleed. The pulp is very upset, it's robust, and it bleeds. This thing was the size probably of your thumb in diameter, and it literally, when we cut it and amputated back farther, so let me back up. So here's where I made my cut. I had to amputate the pulp back 30 millimeters or 3 centimeters so that I could make room for all of my composite to keep this tooth alive. And so when I did that, this thing bled like crazy. And I mean, it shot out literally like a vessel. And so most of the time in a dog, I'll get it to stop probably in maybe 8 to 10 minutes. This thing literally took 50 minutes. And I was and so we just literally sat there and waited and waited and waited for this thing to stop bleeding. And finally it did, but it took over 50 minutes. And you can see it here. I mean, I count the heart rate. You can just watch this vessel pulse. But this is now the pulp, and we have 30 millimeters of distance then to put in. So we put a product called MTA in there, and what MTA does is it builds a dental bridge. It does in kids. They use this procedure a lot in kids. It's called vital pulp therapy. We do it a lot in dogs. And so we did this on this elephant. And so we put this MTA in there, and we took a radiograph to make sure I got enough in there. I wanted at least 1 centimeter. And then we started putting in our composites, and eventually then just put this over that, and we were done. And so there it is. You want to have 3 layers like I do, and woke up very, very quickly. So here was a trauma case that we had 48 hours to prepare, and the surgery was almost 3 hours. Case 2 is a very, very old elephant who's 68, and we have to work on her molars. So this is Cora. She's old. I don't know if you know anything about elephant teeth, but they have 4 molars at a time. And they are what we call a molar progression species. Another one is the kangaroos, the marsupial group, all have molar progression also. So when one molar wears out, the next one pushes that out. When that wears out, then the next one. And so there are 6 sets through the elephant's life. Cora is on her last set. Okay. So what's happened is that Cora, let me back up. When they push forward, these break off in plates, okay, until they're gone. Well, Cora's plates were not breaking off. And so what was happening is she was developing this massive ulcer in the roof of her mouth. So right here, okay, so this is protruding. So right here by where that tusk is this very, very large ulcer. And I could actually put both my fists inside this. That's how big this was. Okay. So these are my kits. This is actually an auto body kit that we use that's hydraulic, that we sometimes have to open, like rhinos' mouths to keep them open so I can work on them. So, we use all kinds of things that we have to use in these large species. These are PVC pipe that I have made retractors so that we can hold the gum tissue back. This is a spilum. So you see these 2 bars. I'm going to be inside this animal's mouth. So these bars help keep the mouth open. So what I did is we made this, and this is threaded, and you can see these drills. So we put 2 drills on each end, and we're able to spin this thing open and hold Cora's mouth open. So that day, which by the way, let me give you a timeline. We started planning this procedure for 3 months. This guy and another guy, he refused to be on camera, and I'll tell you why in a minute. These are the veterinarians that flew in from Florida to do the anesthesia. These people in blue are a rescue group that traveled the Midwest for catastrophes, tornadoes, floods. And what they do is they have equipment to lift horses, calves, cattle, all large livestock out of bad situations, whether dead or alive. They're there in case Cora goes down to lift her up. The veterinarians flew in. So the veterinarian that didn't want to be on camera, nice guy. It's just part of it, all of the PETA issues that happen. He's gotten a lot of flack because he used to work for Ringling Brothers. So Ringling Brothers bought a large amount of property to allow all of the animals to finish up their lifetime, and he takes care of them and flies all over doing anesthesia. So this is the veterinarian. We're all here taking a meeting. So Cora's in her stocks. They've put bands around her feet. They're going to throw ropes over, or excuse me, more ties over the top in case she goes down. Cora loves her drugs, so she's sedated here. And this is the veterinarian, so they're going to cover her face. The veterinarian told me as soon as he gave the drugs that I had 50 minutes to get my job done. That's all that he would allow me to do, and he was reversing Cora because of her age. So here we have the speculum. 2 of us are spinning this thing open to hold Cora's mouth open. I don't know if you've ever been around elephants, but when they open their mouth, literally the gum tissue just folds in. You can't even see their mouth. So that's what these speculums are for, is for them to pull their lips back so that I can work. And so there I am up inside her mouth, and I am removing these 2 molars far enough back to stop the trauma. And you can see here is what we did. Here are the pieces. And we were done in 20 minutes. So what took 3 months to plan, we were done in 20 minutes. So those are 2 extremes of what we have to do sometimes to get ready to work on these guys. So anyway, any questions?
We have one in the chat that says, have you ever had a close call with an animal waking up and under anesthesia?
One, just had a gorilla that woke up. Yeah. So sometime catch me and I'll tell you the story. So yeah, it was very close, but it worked out fine. But I don't know, I don't know, I think we've done almost 1,800 procedures. And so I mean, I'm not going to tell you that we haven't had some that, their jaw tone increase and I had to quickly get out of their mouths, but, truly a very scary event. That was the gorilla. And out of all those procedures, having one, I think that's a pretty good batting record. So, I mean, I trust everybody who does anesthesia. So, yeah, good question though.
Courtney, our zoo liaison, who she and I have worked at or volunteered at Sedgwick County Zoo, she asked if that was at Sedgwick County Zoo.
Yes. Yeah.
Yeah. You were talking about preventative care, and you kind of showed how you did that, how to do that with the apes. How would you, and you also talked about wanting to do as few little anesthetic events as possible. How would you do that with things like canids, felids, and things like that? Because obviously you can't really go brushing their teeth as much as you would like to.
So let me make sure I understand. You mean our domestic dogs and cats, or you mean some of the zoo and exotic ones?
Zoo exotic, the bigger cats. And
I mean, if I looked at this strictly from a dentist point of view, they need to be done every year. Okay. And so I do have like 3 zoos that they're really on board with preventive. So when they do a health exam and it has teeth, they coordinate with me. So, let's just say Sedgwick County Zoo, they've got, they're fully veterinary staffed when they have 3 veterinarians. You know how many animals are there. So besides the sick and the injured that have to be dealt with, when you talk about the preventative and going through all those animals, there's just not enough time in the year to do those. And so it's hard. It's super hard. And there are consequences to that, but they do the best they can. That probably the biggest struggle is that most zoo veterinarians don't know much. With all due respect, they don't have a lot of knowledge about teeth and the mouth, and just so a lot of stuff doesn't get recognized or looked at appropriately. And that's the hardest part. So, and I travel about as much as I can, but yeah, it's a tough deal. It really is. So, good question.
Actually, adding on to that, is there any kind of diet management or enrichment that can help with the prevention that you would recommend, like you tell them to do, or is it mostly based, or do they get to just choose their diet based on nutrition rather than dental health?
I mean, there's probably more things not to give. Does that make sense? We just had this discussion actually 2 days ago with a bunch of zoos, and they're asking about these hard knuckle bones and these things, and I do believe they break teeth. Some of the carnivores, like the cats, when they already have damaged teeth, say due to behavior, then it doesn't take much, maybe what they do in the wild, but because their teeth are already damaged, then they break more easily. It is hard. You want to give these guys something to do and to enrich them and to help themselves enjoy. But if you give inappropriate things, then it's going to be a problem. So yeah, it's hard. But as far as the benefit side of things, again, it'd be like me telling you, if you eat this diet, you don't ever have to see the dentist again. That's just not a true statement. It doesn't work that way. So.
Somebody in the chat said, have you ever done work abroad?
No, I was supposed to do some stuff out of country right before COVID hit. And so that, I don't know if it got canceled or postponed. I just haven't heard anything about it since. But I do a lot of consulting with some sanctuaries and places. But I have never personally traveled abroad. No, I'd like to. Hopefully we will.
Any other questions?
I can tell you all, I mean, I do remember the days when I was pre-vet. I promise I do. It's a long time ago. I would assure you, I never dreamt it would develop a specific niche in my career. I thought I would finish my whole career being a general practitioner, and I never dreamt it would lead to this. And so, sky's the limit for you. I've been super blessed at the opportunities I had and what we've been able to do and how all this developed. But like I said, if I can do it, I'll tell you, I guarantee you, any of you guys can do it. So, keep your hope strong and your dreams big, because it definitely can happen, because it happened to me, and it's been a lot of fun. Even doing the specialty work in dogs and cats and the things we get to do, and the trauma cases. I mean, we had 2 today. We finished up two cats that we finished up that, multiple fractures, maxillofacial fractures that I never dreamt we could get back together. And, we took all the hardware out today, and these guys have a functional occlusion. The owners are ecstatic. I mean, it's a lot of fun. We're having a blast. So it's a good deal.
One person asked, is there a species that you want to work on that you have yet to?
I've never done a giant panda. And so we were supposed to go to Memphis when that cold spell hit. And so, Memphis, when they get, I don't know this, but when they get 3 inches of snow, it's a catastrophe. And so they called and postponed that trip. And so I'm not sure we're going to go, but we also have 2 polar bears we have to do that same trip. So it'll be a big week when we're out there. So we have, I think, a couple polar bears to do in the giant panda. So I've never worked on a giant panda, so that one's going to be fun. So they're all fun.
You'll be there a week. How do you space the pandas and the polar bears out through the week?
That's a great question. Most of the time, if the zoo staff can handle multiple cases in a day, I encourage it, because it's very taxing depending on the trip to go there for just one procedure. When I've gone to Houston, we'll do multiple gorillas in a day or 2 days. And so let's say we do 5 of them in 2 days, then that's a huge benefit for them. Like I tell zoos, I don't care how hard you work me. You've got me for the day. Let's do as many as you can. And so that's what we try to do. So, to tell the zoo staff how easy it is for them to wake these patients up, what I tell them may not even be feasible on their side. So. Good question.
I had a question about your review and your preparing, you work on so many different animals and such different species. How much reviewing do you do before each of these cases?
I hope this doesn't come across arrogant. We've done so many primates that there's not much that I look up. Okay. But definitely if there's a species I haven't done in a while, or it is new, I will do literature searches and do as much work as I possibly can, because I've got to know what to do. And we had a primate that had a trauma a few years ago that the veterinarian just sent the fractured tooth. And she asked me how long it would take me. And I said, probably 50 minutes. So when we got there and we put the animal under anesthesia, we found out that literally he had a Le Fort 1 fracture. And a Le Fort 1 fracture means that his whole jaw was fractured all the way back. His whole maxilla was in 2 pieces. So, you know, not that I was looking up a Le Fort fracture, but I felt like I knew what was going on, and I knew where it was, and I knew what was happening, and so I could guide them appropriately. And there's times that I miss it, but most of the time I try to go to the nth degree to research stuff and know what the most common things are. The thing is there's nothing out there. I mean, that's why this group was started, was that we start publishing stuff and we start documenting stuff and we start doing a better job. And so we're getting more and more literature out there of these cases, so that, you know, things can be published, and there is things for say the future you to look up. Okay. But right now there's nothing, let alone equipment. You know, and that's the other thing, was when we travel with everything, they have to worry about any of these instruments. We have them. So, and if we don't, then we go get them made. So it's hard sometimes. And, you know, especially, you know, say a dog or a cat, and of course there's the bell-shaped curve of those that are so aggressive you can't look at them, meaning a dog or a cat. But literally when you look in their mouth, you have an idea of what may be going on. Okay. For some of these, you don't have a clue. Okay. You don't have a clue of anything. We just did a giraffe not long ago, and all we knew was it couldn't swallow and chew very well. We had no clue what was going on. Okay. And then I found the mass in its neck. Okay. I mean, near its laryngeal area, it had lymphoma. That wasn't on my radar, but we found it. So.
Speaking of your specialized and mostly handmade equipment, I'm assuming in the event that if it's broken somehow, some way, do you have to have special insurance on it?
So what is broken? I'm so sorry.
If your instruments, like your hand, the ones that you personally make, or the ones that have to be specially made, do you have to have special insurance on them?
Special
insurance?
Oh, no. We just make another one. I mean, there are definitely things I bring as duplicates. I mean, we do bring duplicates of stuff, just in case, but most of the time, we're okay. Yeah. I mean, there are times when I'm staying in hotels, which is way too often. I sure hope nobody thinks that something, is super valuable back there, because it won't be for them, but it's very valuable for me. So, yeah.
And then 2 chat questions are, the first one is, do you have a favorite species to work with?
That literally is the most common question I get. And I have to tell you that these animals, I mean, especially when you get up so close to them, and let me preface this when I'm done with this statement, they are so unique and so beautiful and so incredible. It's incredible how they've been made, and, all their specifics, their colors, I mean, you look at the stripes of a tiger or, a zebra when we get to work on those. I mean, it's just unstinking believable how beautiful they are. So I'm not sure I have a favorite, because, even like the little poodoos we're doing tomorrow, I mean, these little deer are so small and they're so detailed and so unique. I mean, I must admit, I don't think I can have a favorite, but I can tell you that some of them smell to high heaven. I mean, it's just, you think they're the most beautiful animal until they get in the OR with you and they reek unbelievably. So anyway, I had to bring that up because, some of them, especially the painted dogs or those guys, your clothes just literally absorb these odors. It's just unbelievable. But, last Friday we did a hyena, and, the dentition in a hyena is so unique. And, if you're ever interested in hyenas, read about them, especially the reproduction. I mean, it'll blow you away, of what a hyena, how they, how they breed and how they have their birth and things like that. So.
And then the last question is there anything that you can do if an animal outlasts their teeth, such as how elephants go through a specific push with their teeth?
Yeah, so if they're in the wild, what would they do? They die, right? The unique part about zoos is they're going to modify their diets. So Cora is, they have a wood chipper that literally, takes the browse and breaks it up into very, very small pieces. And that's how they eat. And so, if I end up having to extract the majority of teeth, then they may steam their vegetables. Okay, so a lemur we did a few months ago literally has, I think, 3 teeth left. So they steam all their vegetables, okay? And so they're softened. With all due respect to how badly zoos sometimes get the rap by some of these organizations, it'll put you to tears at how much they care about these animals and what the nth degree they'll go, not only medically, but how they prepare their foods and what they do for them. And so it is rare that an animal is going to have to be euthanized or will die early as a result of nutrition, because they'll figure out a way to make it happen. So yeah, good question. Yep.
Jamie said, I know you said there is typically more than a few vets in the OR, but is any blood work or pre-anesthetic protocol followed, or just dart them and start working?
If they can get blood work, they're going to ahead of time. But as you can realize, majority of the time, all labs and everything are gotten as soon as the animal is anesthetized. And the great thing about it is it's done immediately. So, probably as soon as all the monitoring equipment is put on, many times the blood has already been drawn and it's being run stat within the hospital to make sure there's nothing going on. So, with that said, some of the chimps and the gorillas know how to give blood. They'll stick their arm through a special device and they can actually draw blood. But I would say the majority are done when they're put under anesthesia or initially sedated, that type of a thing. Yeah, I know very few that get blood drawn ahead of time. Yeah.
Any other questions?
We good?
Yep, I think that might be it.
Thanks for letting me spend the
I know
hour
we
with
talked your brain off. Yeah, no, thank you. I think this has probably been one of our most educational.
Oh, you're sweet. Thank you. You're kind.
And exciting.
Very nice of you.
Meetings that we've had.
Well, you guys get in. We'll your 4th year. I'll be seeing you then. So.
Thank you, Dr. Winter.
Y'all have a great evening and good luck at the rest of your semester.
Thank you. Have a good weekend.
Take care.
Bye. To everyone else, we're going to go ahead and get started on our officer reports real quick. I'm just going to share my screen. Okay. I'm going to go really fast. I told Maddie to put a slide in for me, but it seems that she may have forgotten. But really, it's really fast. The only thing that I have to add is starting next week, I'm going to start letting members join us for our officer meetings so that we can start the process for vetting next year's officers. It's the same exact link that you guys have been using that you used tonight and at the last meeting. If you decide that you want to run, I just ask that you join at least one officer meeting. And then what I'll have you do, if you haven't been or seen the application nomination process, I will have you send me a kind of biography about yourself, what position you want to run for, and why you think you will be proficient at that position. If you need any specifics on what each officer position does, there should be a file on our Org Central page in our Constitution about which each of the positions are. And you could also ask me or the officer that represents that office what they do on a day-to-day basis, stuff like that. And that's also an opportunity that you can ask at the officer meetings. So the officer meetings are every Thursday in between the general body meetings. So next Thursday, we will be having an officer meeting, and I encourage you guys to come. It's the officers and then also our two advisors, so Gayla Adams Wright and then Dr. Pullman at the vet school. So do that, come to the meetings, submit your application, and then at the end of the school year, we will vote, and you guys will be sworn in as the new officers, okay? So then I'll let the other officers do their officer reports.
All right, guys. So if you have independent volunteer experiences outside of the club, you can submit them to count as points. So if you volunteer separately, like at the animal shelter, or if you volunteer like weekly or once or twice at Hope Ranch or something, as long as you have proof, like a picture, a signature, something, confirmation that you actually did it, you can send it in to me and Jordan and get points for that. Also, it's not on the slide, but I'm working on setting up another time for a group to go out to Hope Ranch. It was really fun last time we went. We worked for honestly just about an hour, and then we got to ride horses. So that was pretty fun. So keep an eye out for that. I'm just working on getting a date together.
So the Australia Zoo kind of didn't work out, but I'm still in contact with them. So hopefully in the future, I can get whoever becomes a new zoo liaison the information and we could do something with them later on. But we will have the zoo call April 25th with Taronga, whatever, the Conservation Society in Australia. It will count as a point, so you should come. And once I get more information from them, I will send out a message, but it should be the same Zoom link that we use for the normal meetings for that one.
Okay, so I didn't make a slide, but we are doing a sunset zoo trip on this Saturday at 1, and it will count as a social point. I just want to remind you guys that you need 4 points for us to send it to the vet school. So I don't know, you can look in the spreadsheet and you can find out how many points you have. But if you come to the zoo and just check in with me, I can get you that point, and so you guys can get more towards those 4 points. But yeah, 1 o'clock at the zoo. It's a $5 admission for an adult, so it's not too bad. But just text me if you have any questions.
With that zoo trip, I don't know if that, I'm pretty sure there's also a student discount at the Sunset Zoo, so you might look into that if you're worried about pricing or anything like that. But yeah, so do you guys have any questions about what's coming up, what you need to do to get your points in, or running for an officer position? Okay. So great meeting, guys. I hope you enjoyed. Yes, there is an AZA discount if you have a membership to an AZA accredited zoo. Your membership should be free. So if you have a membership to a zoo, check and see if it's AZA accredited, and you can just do that by a simple Google search. Where do we find the application for? Oh, so it's not really an application. All you have to do is just send a biography about yourself, what you're studying in school, where you're from. You can put all that stuff in there, but the most important thing is what officer position you want to run for and why you think you'll be the best applicant to do the position. And you can just email those to me. I'll put my email in the chat so you guys can send them if you guys are interested. And yeah, it's just a straight biography. You can put a picture in, because when we'll do a PowerPoint so that as people are voting, they can see a picture of you. And yeah, you just do a biography with all the stuff that I talked about. And then the only other thing that you have to do is come to one officer meeting, just to kind of get the feel of what an officer meeting is like, how we run those, and also to meet our advisors. Okay, does that answer your question? Okay. When are the officer meetings? Yeah, so they're the offset Thursdays to when these meetings are. So these are the general body meetings. And the officer meetings are the weeks in between these meetings. So the next one will be this coming week on the 15th. We'll have an officer meeting, and then we'll have another officer meeting probably on the 29th. So yeah, come to those, and then we will vote on officers towards the end of the school year. Okay, if there's no more questions, be free.